do some movements that can really help open up the hips, get baby into good position. This is a combination of spinning babies and the Miles circuit. These are positions that you can do every day in pregnancy, but also continue and do them in your labor as well. So I'm gonna go through these pretty quickly, but feel free to stop and pause at any time if one exercise starts to feel really good for you, and stay in that until you're ready to move on to the next. All right, we're gonna start with hands underneath shoulders, knees underneath hips, just doing a quick pelvic tilt. So tip your pelvis back, tuck it in, back and in. So you're not moving the shoulders too much, just the pelvis back and forth, back and forth. Great to stretch through the low back. Great to bring some mobility into the pelvis. And then when you're ready, tuck your tailbone, move your hips all the way to your heels, and hang out in child's pose for a moment. And you can stay in child's pose as long as you want, but make sure the knees are nice and wide, hips down to your heels, forehead down onto something, either a block or a bolster or the floor. And then as you inhale, peel yourself forward, lift up, look up, arch, and exhale, round, going all the way back. Inhale forward, exhale, going all the way back. I'm moving a little faster here, but move at a pace that feels good, comfortable for you. These movements are more about really enjoying the stretch rather than really pushing yourself. And then pause, and we're gonna do pelvic circles here. So moving your hips to the right, forward, left, and back down. Big circles, bringing movement into the outer hips, low back, belly, and then switch directions. Moving slowly through sticky spots. If you're able to coordinate breath and movement, I highly recommend that. So inhale as you come forward, exhale as you go down and back. And then when you're ready, pause. Bring your knees out as wide as the mat and keep your hips over your knees. You're gonna walk your hands far forward, bringing your forehead down to the floor and elbows down. Stick your butt way up towards the ceiling. So what we're going for is that nice little stretch in the attachments of the hamstrings to the pelvis. We're also here tipping the pelvis back, sort of making the pelvis go upside down so that you're working against gravity. So usually most of the time we have a lot of weight on our pelvis, and this position allows us to take some weight off of the pelvis to be able to loosen the pelvic floor a little bit more. And when you're ready, come back up. All right, we're gonna set into some kneeling positions. So first is a lunge. Just bring your right leg forward, and rather than it being directly forward in front of your hip, open it out to 45 degrees. So both the knee and the toes point to 45 degrees. And you're just gonna bend and straighten. And here you can be, if you need support, you can have support in front of you, like holding onto a chair, or you can just do this with being upright. What's great about this is that it really gets into the psoas, particularly on the left side, also onto the inner thigh on the right. Again, great to do in pregnancy, but also amazing to do in labor. And particularly if you're in labor, you're probably gonna be leaning on something as you bend and straighten. And then we can switch sides. So this time, that left leg steps forward to 45 degrees. If you wanna go even deeper, you can move that right knee back. And again, bending and straightening on that left side. As I mentioned, if you have a couch or something nearby, you might be bending and straightening with your upper body weight, resting on something, or you can do this upright. We'll do this just for a few more. And then when you're ready to switch, standing on both knees, bring one foot out. Your knee points out to the right, your toes point out to the right as well. And here, you're gonna feel a little bit more stretch in the inner thigh. And again, bend, straighten. And same thing here. If you're leaning on something, you can be doing that, or upright. And then we'll switch sides. The other leg comes out. Bend that knee. Make sure the toes point out. Your hips are facing forward, so you're not facing this way. Belly points forward. This foot and knee are out. And bend and straighten. Ideally, your right foot is directly behind that right knee. I just don't have enough space for my foot to be able to do that. But the more I square my torso forward, the more I feel this in the inner thighs and in the psoas. Great. And now we're going to do a standing pose. So come to stand. Bring one hand to your pubic bone, one hand to your sacrum. Just like we did pelvic tilts on all fours, we're going to do pelvic tilts standing up. Soft knees. Inhale, stick your tailbone back. Exhale, tuck your tailbone in. Back and forward. Back and forward. Again, great stretch for the low back, particularly when you tuck. And what's really good about practicing this position is that during labor, this is a great way to get baby's head into the pelvis. So you might spend a whole contraction just tucked in like this, or you might move back and forth. And then we're going to do a standing forward fold. So come to a wall. I'm just going to let this chair be here for now, but what you want to do is bring your hands out nice and wide and fold forward, so you're opening up the chest. Hands are nice and high, open armpits, and here you can rest your forehead on the wall as well if you want, or you can hang out like this. You can stay here for as long as you need. This is a great position for somebody to apply sacrum pressure here, to do the double hip squeeze on you as well. Open up the low back, and when you're ready, come back up. I'm just gonna adjust my mic here. All right, next we're going to do a windmill. So grabbing a chair, or if you're doing this against a couch, totally great. You're gonna bring your hands down, feet out pretty wide. So as you inhale, lift one arm up and twist, exhale, windmill down. Inhale, other arm, exhale to windmill. Inhale to lift, exhale, windmill. This is one of the Spinning Baby's recommended daily movements, and it's a really great way to get a nice open twist in the chest and low back, something that you're not necessarily able to do in pregnancy, so this is a great safe twist. All right. And now we're going to set up for lunges. One leg forward, one leg back, and you can either bend and straighten just like you're doing upright, or bring your foot outside of the chair and bend and straighten here. You can also hold the top of the chair if you need a little bit more elevation. Bend, straighten. I find that I'm getting a little bit more being upright, so I'm going to stay upright. Great, and then we'll switch our feet. Left leg forward, other leg back. Bend, straighten, bend, straighten. And again, if you're holding on, you can do it like this as well. All right, now we're going to do the same thing, except we're going to bring our feet up on top of something and do your lunge here. Bend and straighten. And what this does is that it really allows one side of the pelvis to open up nice and wide. And you can do this on a chair, or on a couch, or on a stool. And then when you're ready, switch directions. So bring the other leg up. This leg is strong. Bend, straighten, and same thing as we did just as you're standing, except you get a little bit more space on one side versus the other. Here you can be holding on to a partner, holding on to a support person to be able to get into it a little bit more and to be able to really rest your weight rather than holding yourself up. And that's something that I would recommend in labor. All right, next, we're going to just do a wide-legged forward fold. So come to sit, feet out super wide as you would like to go. Scoop your glutes back. If you can sit up on a cushion, great. If not, no problem. Just walk yourself forward and stay. You can stay here for as long as you like. I'm just going to hang out here for 5 breaths to open up hamstrings, low back. As much as possible, flex your toes. You can get into the inner thighs as well. 2 more here. And out. Great, come all the way back up. Hug one knee in and then the other. And now come to sit up, either on your chair or on your couch or bed. You're gonna grab either, a cushion works well, and you're just gonna squeeze your knees in. So here, this is gonna activate the IT band, activate the outer thigh. You might also feel your abdominals engage. Staying here. This isn't one that I necessarily would recommend doing in labor, but this is a great one to do while you are still pregnant, to build that inner thigh strength, sort of like a thigh master, and to also build that glute strength as well. All right, and then release. And here we're gonna open up the hips now, so hug one knee in, butterfly it open, ankle on top of the knee. You can sit up nice and tall and just use your elbow to open up that hip. I'm gonna stay here for 5, option to flex those toes. And out. You might not feel it as much if you lean back, so sit forward as much as possible. Another 2. And switch sides. Ankle on top of the knee, using your elbow to open up the thigh, and then lean forward ever so slightly. 2 more here. Great. And then come back up. We're gonna come down to the floor for a bridge pose. So here, come to lay all the way back. If you feel any type of breathlessness, I would not recommend doing this. Do this only if you feel good doing this. And then when you're ready, fingertips should be able to tickle your heels. Just squeeze your glutes and lift your hips up, up, up. Squeeze your glutes, hips come up nice and high, chest towards your neck. Great. And just staying here for 5. You can tuck your shoulders underneath you, maybe even interlace the hands underneath your shoulders. This is a great way to open up the shoulders as well. 2 more. Squeeze the glutes to lift up nice and high. 1 more. And again, this is a great way to get weight off of your pelvis. And then come back down. While you're here, another great option is to lay down with your feet up but your knees bent. So a couch works really well if it's the right height. So what you want to do, thankfully my couch is the right height, you're just going to bring your knees up and then butt close as you lay down. What is so great about this position as opposed to legs up the wall is really great as well. It's just more extension in the hamstrings. Here, you're really allowing your psoas to relax. You're allowing your hips to relax, and you can stay here for as long as feels comfortable for you, good for you. I could stay here all day, but moving on. All right, next. I'm going to show you the forward leaning inversion that is recommended by Spinning Babies. Spinning Babies recommends that people do this in pregnancy once a day. Again, what it does is it takes weight off of your pelvis because you're going upside down, which allows for a quick release. So you want to find a bed or a couch, come to kneel at the very edge. If you want to have support, have somebody with you the first few times that you do it, and just in case you're nervous. Start with your hands just at the very edge, and your knees are going to be at the very edge. Press the tops of the feet down into the couch, into your bed. Bring one hand down and then the other. Pause, see how you feel. If you're ready, one forearm down and then another. And then you can stay here for about 5 breaths. If you have a support person, they can just be gently putting pressure on your low back to help release. Great. 2 more. You're not staying in this very long. And out slowly. One hand presses up, other hand presses up. One hand to the couch, other hand to the couch, and then sit up on the couch. We're gonna hang out here for a minute. This is so that once that you've gone upside down, that you actually are allowing your pelvis to stabilize by staying upright for about 30 seconds or so before you do any other movement. So, all right, when you're ready, I'm gonna just show you how to lay down. So this is a great way to make sure that you don't have, really painful hips when you wake up. It's a great way to avoid low back pain if you're having that when you wake up. I'm gonna grab a pillow. So this is just a regular pillow, nothing fancy, nothing special. You want to bring your head onto one, so this, you might be using a regular pillow. So now what I'm doing here is making sure that the pillow is in between both my knees and my ankles, so that this way if I'm doing just the knees and not the ankles, it can pull a little bit on the back because they're not parallel. So I highly recommend parallel, knees and ankles. This is one way to hang out. Another way to hang out is to put a little towel or something underneath the belly. But now this time the knee and ankle are supported just on one leg. The other leg goes all the way back. So I obviously don't have enough space to be able to do it here. Maybe I can do it on the bed, on the floor. But what you're doing is leaning so far forward, almost forward in front of belly, so that this back leg can go back. It can also bend so that you're leaning a little bit more forward. Not totally on your belly, but a little bit more. This left hand can go all the way back, and you can hang out like this. I hope this is helpful. Thank you.